Hello, 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 everyone. It is Dr. BrandiB. Thank you so much for waiting for me. I am doing a sure enough afternoon edition today, and I appreciate you all being here with me. It's Friday, y'all, so you know that means welcome to Focus on It Friday. We are going to have a good show today. We're going to be asking the psychiatrist. Hello, Mr. Donnell. Thank you for joining. First one here that I can see today. So thank you for watching. Come on in and let me know that you're here. Miss Sadie, you're with us, and we appreciate you for joining Focus on It Friday. Thank you all so very much for coming. We've got Sandy Nolan, and we appreciate you joining us for Focus on It Friday with Dr. BrandiB. Thank you all so much for coming on. I know that I'm late today, and I apologize, but I worked today. And I had blocked off from 12 to 12:30 thinking that things would go that way, and things did not. Things did not go that way, but I am here, and I appreciate you all for joining me and being patient with me. So thank you, thank you, thank you. Thank you so very much. All right, we've got 6 people joining us right now. I hope you all have invited someone to share and join us at Focus on It Friday, where we have a huge and a great time. I sure do know that I do. I enjoy being with you all. And that's why no matter what, I go out of my way to make sure that I can make it here to see you at Focus on It Friday. We've got Katie Childress. Thank you for joining. Miss Luella Marbury. Thank you for joining. We've got Nia Nicole. Thank you for joining. So many people are coming in. Come on in. It's Friday afternoon, later in the afternoon than we normally are here, but we are here nonetheless. And we are talking about Ask the Psychiatrist. Focus on asking the psychiatrist. I've got some questions of some things that people asked me this week, and if you have any questions, you can drop them here. I will be more than happy to get them answered for you. I'm going to go ahead and get started, though. Miss Erica Harris has joined us, and we appreciate you for joining, Miss Erica. Going to go ahead and get started. I am Dr. BrandiB, your triple board certified child and adolescent psychiatrist. Through my Facebook live streams, my face-to-face or telemedicine or virtual programs, and my upcoming book, which should be out. I actually should have a copy in my hand soon. I'm so excited. And it should be available for you all to purchase here in the next month. I do all these things just to help worried moms, dads, medical professionals, teachers, and anybody else get the education that they need so that they can help the children and adults who have ADHD in their lives be successful in the classroom and in life. And we've got Miss Mary Ann Gunter Dollar joining us. Thank you so much, Miss Dollar, for joining us today. We are talking with me, and we are asking the psychiatrist. So I've got some questions that I'm going to go over. If you have any other questions, just drop them in the chat. I'll be happy to answer them. So somebody wants to know, what is the wait to see a psychiatrist? Well, that wait is going to vary based on where you are, based on, what you might be looking for in your psychiatrist, based on several different things. But in general, you might need to calculate in or account for, be prepared for a 3 to 6 month or longer wait. Hello, my auntie Gail. Thank you for joining. Leslie Taylor Drew, thank you for joining as well. So 3 to 6 months is about the average wait for a psychiatrist, child, adolescent, or otherwise. And some even longer. Some I know of that are 1 year long. So what does that mean is going to happen? That will mean that if it's a child that we're talking about, they will need to see their pediatrician or their family doctor to be able to bridge them until the time that they can see a psychiatrist. Most psychiatrists I know are not going to give you any medicine until you actually see them. So you're just kind of at the mercy of your pediatrician until such time as you can get in. So you may want to factor in 3 to 6 months at least, if not longer, before you can get in. And for heaven's sake, if you get an appointment and you've waited 3 to 6 months and you just decide that it's too late, you don't want to go ahead and call the office and let whoever you and if you don't, do the courtesy extend the courtesy not only to that doctor, but to other patients, it's almost kind of selfish. Now, things come up at the last minute, but sometimes, I had a lady tell me one day her husband was off work and she just wanted to lay in bed with him. And I thought, okay, to the back of the line you go. But shame on, somebody else could have had that appointment. So just think of that, factor that in, 3 to 6 months or longer. Somebody wanted to know, what's the difference between a psychiatrist and a psychologist? And I'm glad that you asked that question. A psychiatrist is a medical doctor, so they either have an MD or a DO. A psychiatrist is a medical doctor, so they have an MD or a DO. A psychologist is a doctor of philosophy with a specialty in the psychology area. They can either have a Psych D or a PhD. Both are called doctor, but only one of them can treat with medicines. That is going to be the biggest difference, especially in the state of Alabama and in most states, to be honest. The MD or the DO can treat with medicine, which is why we call them a psychiatrist. They treat with medicine, whereas your psychologist gets the gist of medicines but cannot prescribe them. So your psychologist can give you the gist of medicines. They get the gist of them. But your psychiatrist can treat with medicine. Hopefully y'all got that mnemonic. I love ways to remember things, mnemonic, ways to bring things back to your memory and to make them make sense, okay? Another big difference, that is for sure the biggest difference, but another big difference is that most of the psychiatrists that you are going to encounter only do medication management. What does that mean? We prescribe medicines. Many of us do therapy in the middle of the session, but by and large, most psychiatrists are not going to be available for you to call up to just engage in therapy. So you really want to make sure that you understand the purpose of the meeting and who it is that you're going to see. Because if you do not want medicine, please make sure that if you've looked and identified the person you're about to see as a psychiatrist, make sure that they do therapy. All right? If all you want is therapy, make sure that the psychiatrist does therapy, because many do not. I got another question. It was my stepchild has ADHD, and he does not look like my child's ADHD. So this was a mom who said, you're thinking my child has ADHD, but I see ADHD in my stepchild, and my stepchild does not look like what my child is doing. So clearly my child, who is a high school student, cannot have ADHD. Well, we talk all the time now about the confusing things that come with comparison. So make sure that you don't even compare your own children, because it can lead to badness, right? Every human being is an individual, and even though we may look alike, sometimes be even identical twins, we are still individuals with different needs, different behaviors, different thoughts, different everything. We're unique, we're special, we're individual, okay? The second thing is that you should remember that ADHD is actually a spectrum. Now, spectrum is not in the name of the disorder, but if you think about it like a spectrum, it would be easier for you to understand that no two people look alike when they both can have ADHD. So in younger kids, they could be hyperactive, extremely hyperactive. In the middle school kids and age, they could be inattentive. That could be inattentive. The primary presenting symptoms could be those of inattention. And then for the high school children, it could be a little bit of inattention, or it could be impulsivity, like drugs, sex, and rock and roll. Recall that there are 3 types of ADHD, and we go over this all the time over here with Dr. BrandiB, but there are 3 types of ADHD. None of them include ADD. They're all ADHD, and then you are either the primarily inattentive presentation, primarily hyperactive impulsive presentation, or you are combined. You're combined. When we talk about, again, going back to this summary, what I call the changing faces of ADHD, in the very young children, they are going to be hyperactive. The hyperactivity is what gets them into trouble, okay? And then in the middle school children, the thing that's going to get them into trouble the most begins to be academics. So the inattention comes into play. And then with the older kids, it's going to be impulsivity. Drugs, sex, rock and roll, driving too fast, engaging in things that are just impulsive in nature. And then that can lead to all the badness that I always talk about, like them dropping out of school, them getting on drugs, them being more likely to have teenage pregnancy or teenage birth. So all of these are the things that we definitely want to get under control. Now, I'm not saying that, a kindergartner can't have impulsivity. In fact, they do. They're hyperactive and they're impulsive. They're jumping off the banister and breaking their arm because they thought they could fly because they had a cape on, right? That's part of impulse control or the lack thereof. So we want to make sure that we are controlling their symptoms no matter the phase. So that was number 3. Now, number 4 said about medication. Do I need to give my child's medication on the weekend? We've had some people to come in. Let's speak to a Miss King. Thank you for joining. Miss Sadie Gresham, Leslie Taylor Drew. Thank you for joining. Let's see. I've got Miss Frida Fountain. Thank you for joining. And I think that's it. If y'all have any questions, to go ahead and type them in. Are y'all all right this afternoon? Are you following me? You all right? Go ahead and type in the chat, I'm with you. Type in the chat, I'm with you, so that I know you're with me. I see that there are 14 of you, but I just want to make sure that you're with me. Are you with me? Let me see if you are with me. All right. So that was 4. I think I saw, Karen Reed. Thank you for joining. I saw it, and then I didn't see it that time I just looked over. Okay. Anybody else have a question? Anybody with me? Anybody with me? All right. Nobody's with me? Nope. All right. I got another question here. This question says, my child masturbates. What should I do about it? My child masturbates. What should I do about it? All right. This child was somewhere between 5 and 10. Parents were disturbed because the child masturbates, and somehow the people at the church found out about it. All right. So what do we do when your child masturbates? Anybody with me? Can I not see my comments today? I see them. Yeah, okay. All right. Say, you with me? Are you with me? You're here. All right. Frida says, I'm with you. Okay. All right. Miss Sadie. Okay, they're coming in. I was like, oh my goodness, they're not with me. Miss Sadie says she's with me. Miss Mandy Hughes Sexton says, with you. Auntie Julia says, with you. Hello, hello, hello. Miss Marianne is with me. And Miss Keena Bailey, my sister, she says, I am with you. Yes, yes. Auntie Gail says, can you tell the difference once the child gets on medication in his personality? So the goal of medications is to have a child who can focus, who can sit still, who can complete assignments, who can get all A's if they're capable of getting all A's, and who will still maintain their personality, their interests, their dislikes, and whatever else it is that they want to do and that you want them to do. I used to think that medications did not change kids, and then I thought, well, they actually do, because most parents are used to children who do not get things accomplished, and you will find that your child does get things accomplished. But yes, the medication can change them, but it should not be changing personalities. I tell parents all the time, I am not a plastic surgeon, so I am not making people over. Zombies are not what I am into doing. So the medicines should be beneficial, but your child should still behave and be him or herself. That was an excellent question. Auntie Rosalind, let me write that question down. Auntie Rosalind says that she is here. We appreciate it. Thank you so very much. I guess I don't have a pen. Let me get a pen. Hold on. Let me get a pen. Write that down. Write that down. Any other questions? That was a good one. That was a good one. Well, this pen, I like these things, y'all, because we are very informal over here. All right. All right, no more questions. Let's go. So the somebody today asked me about their child masturbating. The child was between 5 and 10 years old. They wanted to know, oh my God, what do I do? Okay. What do you do about a child masturbating? You give them instructions about where they should do it. Okay? Now, remember that if you're a little bit childish, you know, you might not need to listen to this part, but all of us are here, which means somebody did something. Somebody had sex, okay? If you think about it, very early in life, hello, Teresa, Miss Dobbins is here, hello. If you think about it, very young kids can't control much of what happens to them. If they're hungry, nobody, they can't get milk. They can't change their diaper. But one of the very early things that you learn as a human being is that your genitalia feel good if you touch it. When we get to kids being older, going off to school, okay, and then erections start and all this kind of stuff, the kids who have some intellectual challenges, okay, they may not understand that socially, and then from an impulse control standpoint, there is a place and a time to do these things. So what you have to do, mom and dad, is make sure that you set the parameters. Hello, mommy. Thank you for joining. And you tell them you do this in your room alone. Close the door. We don't want to know. We don't want to hear. We don't want to see it. But the more you try to tell them not to do it, the more they probably will. We just want to set some guidelines and parameters around where to do it. Go in your room and do it. Do not do it on any device, your cell phone, your computer. Don't pull up any sites to look at it, because then you could get in trouble in that way. But the long of the short is that if you try to stop it, you are going to drive yourself crazy. So just tell them where they can do it. Give them some parameters, right? And school is not one of those parameters. But just recall that this is a natural phenomena as part of growing up. So if you have a teenager or an older child who may have some intellectual disabilities, not just learning problems, but intellectual disabilities, problems understanding what is okay to do in the world, then you will have to help them with that. Hopefully that made sense. All right. Somebody wanted to know, people always have medication questions. Why do the medications need to be increased? Medications for ADHD need to be increased because they are based on weight. So the more that you weigh, the more medicine you will need. The more that you weigh, the more medicine you'll need. So it's kind of like with a 6-month-old who has a fever, you're going to give them Tylenol. You're going to give them acetaminophen. You're going to give them ibuprofen, which is Advil. All right, you're going to give them that. But when that child turns 6 and even 16, if you're still giving them the dose you gave them when they were 6 months, guess what? It's not going to work. And then you're going to say, oh my goodness, this child still has a fever. And I'm going to say, well, you're giving them that baby dose, so you get baby effects. Right? So the medicine will have to be increased. We start low, we go slow. And that is why we have to increase the medicine. All right. What other questions do we have? Do we have any other questions? Those were the only ones that I had prepared. But did you all have any others? Any other questions? This is your time to ask the psychiatrist. No questions? I know I should give y'all a second. Will a child need medication for the rest of their life? So 50% of people grow out of ADHD, 50% don't. And when I say grow out, it's really more that they learn how to manage it. Now, of course, the choice to continue to initiate and continue medication falls on the parent and the child. I will say this, the older that a child gets, the less likely they may be willing to come to see a psychiatrist or even be willing to take medications. So they may want to stop, but I try to encourage adolescents that this is exactly the time you need to continue, because this is where we get into the drugs, sex, and rock and roll. This is where we get into the grades not being where we want them to be. And so it really can be problematic. Adults can have ADHD, and a lot of them do. And what ends up happening is they can't hold a job. They find themselves in fights. And then people want to say that they're bipolar. And we can go back to last week's live stream and listen to the talk about bipolar. So it's just really a personal choice about how well is the child able to control it. Are they still hyperactive and impulsive and getting into trouble with the law? Or are they primarily inattentive, but they're in college and they keep missing deadlines? They can't remember the answer to the test even though they studied. Or they're so irritable that nobody can even hardly stand to be around them. So you just really have to look at it on a case-by-case situation and figure out, if the kid can have a calendar with sticky notes all over it that they can keep up with, then perfect. But otherwise, medicines can be beneficial. That was a good question. Let me write that down. Need medicines for the rest of your life. Okay. The next one, Miss Mary Ann says, can ADHD cause high anxiety when being in a crowd? That might be an unusual thing. That's a case-by-case situation. But in general, usually when I see anxiety and ADHD, it comes with children who are not treated because they are used to being able to perform academically and in social settings and meeting deadlines. And then all of a sudden, when they are not able to, the anxiety can creep in then. So not so much the anxiety when being on a crowd. I would just look for anxiety and make sure that it's not there. Hello, Miss Vicky Bowling. Thank you for watching. These are good questions, good questions. Let me write that one down. The meds cause anxiety in a crowd. All right. Anything else? Y'all got the doctor here. Speak now, forever hold your peace. What causes night terrors in people, and can it be controlled? Oh my goodness. So y'all know the difference between a night terror and a nightmare? Well, if you don't, let me tell you. So a nightmare is just simply a scary dream. Simply a scary dream. You wake up, you remember it, and you're like, oh my God. Once you get oriented, you're like, oh my goodness. Okay, let me get myself together. That was a horrible dream. And if you're like some people I know, if it was real bad, you don't tell it before noon the next day. Now we know that, or it'll come true or something like that. But that's not true. Okay. However, night terrors are when people have a bad dream that causes their autonomic system, which is all the symptoms that tell you fight or flight. It kicks that into gear. So your pupils may be big, your heart is racing, you may sweat, you may be panting, all of that. But the key is that you are not awake. Super scary for a parent to go in and see a child having a night terror. But the kid the next morning has no idea that it happened. So two ways that a night terror and a nightmare are different is that a night terror, they're not awake and they don't remember it. A nightmare, you wake up and you can tell somebody about it. So the nightmare is scary to you. The night terror is scary to whoever's watching. The question was, what causes them? It's really hard to tell. Loaded question for sure. But abnormal sleep patterns can be at the base of them. And so one of the treatments that I often tell parents is to wake the child up about 30 minutes into the sleep cycle, restart it, and then to reset the sleep cycle, and then they oftentimes can go through the night. Now, sometimes we can control them with benzodiazepines, and if you think about it, benzodiazepines are like your Ativan, your Klonopin, your Xanax, those types of things. Sometimes we can control them with those. Now, I do not prescribe any benzos to kids, right? So that's not going to be me if you coming to me trying to get night terrors controlled. But if you think about it, it's an anxiety sort of picture, right? So elevated heart rate, blood pressure, I'm super scared, give a benzo, it helps. But those are in extreme cases. So just trying to reset the sleep cycle by waking the child up or the human up is one of the things that you can do. Good question. But really the biggest difference is knowing the difference between a night terror. And night terrors, like I said, can be really scary for the person who's watching, because you're watching this person scared out of their mind and they are not even awake. They are not even awake. They may be talking to you, but they're not awake if it's a night terror. Miss Marianne says, thank you, and thank you. Of course, of course, of course. Any other questions? Any other questions? Let me write that question down. Night terror causes and treatment. Any other questions? Now, I know y'all be in my inbox. This is the time to ask. This is the time to ask. All right. Well, if there are no more questions, then we will jump off. I'll go back over what we said. What is the wait for a doctor? About 3 to 6 or more months. What's the difference between a psychiatrist and a psychologist? A psychiatrist is an MD or a DO, so a medical doctor, and they actually can treat with medications, whereas a psychologist gets the gist of medicines but cannot treat them, right? Both can do therapy, but usually you're going to find that psychologists do therapy, and psychiatrist tends to just treat with medicines. The next question is, my stepchild has ADHD, but doesn't look like most other kids that I see with ADHD. Remember that ADHD, even though it's not in the name, ADHD is really a spectrum. So you can have kids who are only inattentive, just hyperactive, just impulsive, or all three. And even within those subclasses, it can still look very different. So make sure that you avoid comparing, right? Comparison. I advise everybody to stay away from that because it is so dangerous. It'll have you thinking that you're not on the right track, on the same track, like things are off with you, when in fact, you're doing just what you need to be doing at the time you need to be doing it. What does ADHD look like over time? Remember, the very young can be extremely hyperactive. The middle school kids can be inattentive, and that's what gets them in trouble. And then your high school kids can be the hyperactivity, the impulsivity, drug, sex, and rock and roll that get them into trouble. All right, let's see. Will my child once a kid starts medication, will they need to be on for the rest of their lives? It depends. My general rule is if you don't need medicine, don't take it. But if you do, do what's best for you. Number 7, can the ADHD medicines cause anxiety in a crowd? That is not something that is very common. But again, if that's something that you're experiencing with your child, it definitely needs to be followed up with your doctor. Night terrors, the cause and the treatment. And we discussed what the difference between a night terror and a nightmare is. We talked about some of the treatment options. Why do meds need to be increased? Remember, medications are based on weight, so the more that you weigh, the more you'll need. Baby doses give baby results. Some people say, I don't want the side effect. Well, you get baby side effects too, but more importantly, you'll get baby results. My child masturbates, what should I do? Tell them to go in their room, tell them to clean up after themselves, leave all of that in there. Yes, if dolls are involved, tell them they cannot be using anybody else's in the house. So can't be using baby sister's doll to do that, right? So just set some groundwork, set some parameters, let them know what needs to happen. All right, I see we have a new question. How to discuss the diagnosis with the child, the diagnosis of ADHD. I think just with any diagnosis, let me write that down. That's a good question. How do you discuss diagnosis with child? These numbers are messed up. 5, 6, 7, 2. Okay. How do I discuss the diagnosis with the child? So meet the child where they are. If the child, I'm not a huge fan of lying to children, of lying to patients, period. Because the truth of the matter is that the child, and this is not necessarily answering your question, but this is just me about how I do. The child knows if they're neurotypical, they know that something is wrong with them, right? Like a child I had this week, when the mother said, but my child doesn't act like the other kids that I know who have ADHD, the child was old enough to say, Mama, this fits me, right? So kids know what's going on. They may not know what the name of it is, but they know that something is causing them challenges in life and academically. So Meet them where they are. If they say, Mama, what am I taking this for? If they're 12th grade, you might say, son, you have ADHD and this is going to help you focus. What I told a child today who said that he felt like he was a psycho. He felt like he was a psycho because he had to take medicine. He was wearing glasses. So you know what I did? I said, why do you wear glasses? He said, because I can't see. I said, what do glasses do for you? He says, it brings things into focus. I said, oh, focus. Are you talking my language? I said, what happens if I replace your lens with just regular glass? He said, I can't see. I said, and what happens if you can't see? He said, I'll fail my grade. I said, okay. So then what did I do? I said, let's say your brain is out of focus. What we gonna do? We're gonna put some glasses on it. And he was like, we are? I said, yes, we're putting glasses on your brain. And I said, right now, because he didn't want to increase his medicines. He had no good reason except that he felt like he was psycho. So I said, right now, your brain is wearing glasses that only have glass. It's not working. I said, what we need to do is get a lens in the glasses. He said, really? He was about 10. So I met him where he was. I didn't try to convince him, you need this medicine because of X, Y, and Z. Like we tell teens who are smoking. We don't tell them you're going to get lung cancer. We tell them, if you keep smoking, no pretty girl is going to want to kiss you on your lips. Oh, she won't? No, because your breath stinks and your clothes do too. They don't want to hear about lung cancer. That's what happens to old people. When they're 16, being able to not kiss the pretty girl that they like, that might get their attention. All right? So, we're talking about, going back to the question, how do we tell the child? We meet them where they are. I met that child where he was. I used something he already had, which was glasses. And I said that your brain needs glasses and we need to make it so that the lens works. He said, let me get the good lenses. And that was that. So meet the kid where they are, give them what they need, use terms that make sense to them. Some of these terms I use on here are too big for some of y'all. And I try to really make them simple. But just meet them where they are. If they're like, I take this medicine, it helps me be good. If that's all they need, go for it. Some parents say, well, I give my child vitamins. Well, eventually your child's going to grow up and they're going to know that vitamins come off the shelf at the local pharmacy, not from somebody like me. Because I'm going to talk about how, when they come to me, I'm going to say, how are you focusing? Are you sleeping? Are your grades good? Are you getting in trouble? All right? So, yeah, some people give vitamins for their child's ADHD, but make sure that you're being as honest as you possibly can because kids are not smart, right? Right, they're really smart. Hopefully it answers your question. That was a good one. Let me see what else we got. How to discuss the diagnosis, yeah. So just be honest and meet them where they are. If they don't care and they show up every morning and they run away, well, keep rolling with it. But if they say, Mommy, what is this for? Now you got to decide. What do I tell them? And just be honest. Keep it simple. Keep it age appropriate. Hey, Nikita. She says, are there signs that can tell you when your teenager needs a professional to talk to or if they are just through getting comfortable as a teenager? So it depends. If you notice that your child is extremely irritable, and they don't want to talk to you, you notice that their friends are changing, you notice that their eating habits are changing, you know that their sleeping patterns are changing, you notice that their grades are changing, you notice that their interests are changing, you notice that they're not performing on the field like they used to, in the classroom like they used to, they are annoyed by everybody, their sister gets on their nerves, their brother gets on their nerves, just you breathing gets on their nerves. It may be, and they won't talk. You have no reason to explain this. It may be time to get a professional involved. And my general rule is when people ask a question, when do I know that it's time to, I need to see a therapist? When you ask the question. Nobody's thinking about a therapist if they don't need one. But when people call me and say, do you think my child, you just asked me, so the answer is probably yes. So that's a good rule to go by. If you feel like you can't get through to them, and the teenage years are getting the best of them, you and everybody else in the house, even the dog runs when they see them coming, then it might be time to get some other help involved. That was a great question. What other questions do you have while we're asking the psychiatrist? Signs that we need a professional. I love it. I love it. I love it. I love it. All right. I want to ask this question. Y'all still with me? Just let me know if you're with me. Say, I'm with you. Let me hear if you with me. GP, are you with me? All right. Let me know you with me. Are you with me out there? Miss Allie Crum Young. Hello, girl, all the way from Indiana. Thank you for joining. Thank you for joining. Miss Luella Marbury. I think I said hello, but hello just in case I didn't. Miss Stacy Cole. Thank you for joining. Miss Stacy Cole was hanging out with me, y'all. Today was rough. The days are... Dr. BrandiB needs a vacation. Like a real vacation. Auntie Julia still hanging in there with me. Miss Auntie Sadie says, with you. Vanessa is with me. Miss Frida says, I'm with you. Somebody says, sleep tips. We will come back and answer that. Miss Mary says she's with me. Nikita, I'm with you, friend. Girl, I still have your t-shirt. I have your It's Okay t-shirt over here. Miss Cassie, thank you for joining. She says she's with me. Auntie Gail says she's with me. Miss Luella, I'm with you. Miss, is it Pamela Shaw Rawlings said some good sleep tips. I'm going to come back here to you. Diane Rudolph, that's my mommy, y'all. She says she is with me. My sissy says I need a mental health weekend. You ain't never told no story. Working today wore me out. And I was like, oh, Lord, I told him I'm coming at 3:30. So let me get some lipstick on my face. Well, see how I'm talking? Lipstick on my face. Lipstick on my lips. So I won't be over here looking dead. Hello, Miss Thelma Mason and Miss Pamela. Tell me how to pronounce your name. I want to get it right. I don't like calling people the wrong name. That's disrespectful. She says she is with me. Oh, she says yes. Miss Isabella Combs wants to be in my video. I think you probably typed that in error. But let me know if you want to be on the video for real. Just type it in the chat. We'll bring you on. All right. Miss Pamela, I hope I got that right, says, sleep tips for kids to stay in their room. Let me write that down. That's a good question. Sleep tips. We're going to take 2 more questions after this one, maybe 3. So get your questions together. Don't be in my inbox talking about I wanted to ask you this. You better ask right now because I am unplugging for the rest of the night. Now, if you're my personal friend, don't be like, well, we thought you was unplugging. I'm unplugging for the rest of the world. I'm off duty. Dr. Brandy, Dr. BrandiB, Dr. Brandy Rudolph Boland, and Dr. Boland are all signing off. If you know me as Brandy, we can still hang out. Pamela is how it should sound out. Thank you, Pamela. All right, I had it. Okay, so she had a question. She said, what about sleep tips to kids to help kids stay in the room? So a couple of things. Okay, so there are 2 types of kids that sleep with you. They're the kids that start out sleeping with you, and they're the kids that start out in their rooms and end up in yours. Now, first thing I'm going to tell you is that if you are married, and even if you're not, kids don't deserve to be in the bed with you. That's not where they should be. They should be in their own room. But let me tell you how to get them out of your room. I'm going to give y'all all my secrets. My coach would say you tell them too much for free. Okay. If your child starts out in the bed with you, you could go cold turkey. There's crying it out. All right. C-I-O. Cry it out. Which is what a lot of parents and some of the sleep specialists say you should do with very young babies. When you first want to get them out of your room or out of your bed, you send them to their room and you just make sure they have everything that they need, and you commit yourself that it's okay to leave them there, and you let them cry it out no matter what, okay? I did somewhat of a version like that, but by the first year, everybody was out of our room. Actually, the first one stayed in our room for a year in his own little area, crib, whatever. And then the other 2, by 6 months, they were gone. Actually, the middle one, bless his little heart, little middle baby, he was in his room from day 1 because the other one had been in there for a year. All right, so And then Faith was probably in our room for about 3 or 4 months. She was a little bit more difficult. Imagine that. But if they're in the bed with you, you may want to gradually work them out of the room. So make them a little pallet. And first thing you need to do, this is what I used to tell parents, for a week, put them on the floor next to your bed. If they come into your bed, you put them right back on the pallet. Back on the pallet. Back on the pallet. Don't let them get in your bed. Then you may work them to the foot of the bed. Put them back at the foot. Then you spend the next week putting them outside or inside of the door. Then the next week outside of the door. So we're going on like 5 or 6 weeks. Then you put them outside of their own door. Then you get them in their room and you don't really care what they do after that. And you encourage them to stay there. Please don't lock children in their rooms, because if a fire breaks out, they need to be able to get out like everybody else. And you don't want to have to try to figure out, where's the key and all of that. So please don't lock children in their rooms. But you will have to get up and escort them back, which goes back to the other option, the child who comes into your room in the middle of the night. Now, our kids don't do it frequently enough that if they come, we leave them. But if I had a child that I was trying to train to stay in his or her own room, you've got to physically get up and either walk them back or tell them to go back if they will. And you have to do that consistently. This is where parenting as a active participant sport gets into play, not passive, very active. So make sure that you're sending them back or taking them back. All right. Any other questions? Any other questions? But yeah, kids don't need to be in the room with their parents. They don't need to be in the room with their parents or parents. So even if you're single, send that child to his or her own room. All right. Anything else? Anything else? Oh, let me look down here. Oh, we got more. Let's see. Okay. Awesome, awesome, awesome. Well, I guess that is it. If there are no other questions, we're going to jump off. If you have not already signed up for my video, thank you. You're welcome. Was that helpful or did you need more? If there's something more specific, I can address that as well. If you have not signed up for my video, my free video, 7 Tips of Success in the Classroom, please go on over to ADHDsuccess.me and sign up for that. Miss Keena, would you put that in the chat for me? ADHDsuccess.me. ADHDsuccess.me. I want everybody on here to go over there and get that video. It's less than 5 minutes long, but it's going to give you some really good tips to help your child in the classroom to be successful. It doesn't just have to be ADHD. It could be anything. So make sure that you're doing that. The other thing that I want to really encourage us as parents to do is to make sure that we're advocating for our children. Get out of your child's way. So many times parents are standing in their own child's way because of whatever our hangups are about mental illness, okay? So make sure that you're getting out of your child's way. Somebody put that in the chat for me. Get out of your child's way. Just like get out of the way. Get out of the way. Because you could be in your own way. Get out of the way. Somebody put that in the chat for me. Get out of the way. Because really we are not where we could be because we're standing in our own way. We're thinking about what somebody else may think. Does that work for older kids? Does that work for older kids? How old are we talking, Pamela? You can inbox me, and we will we'll sort it out as well. What you said about sleep? Send me a message. ADHDsuccess.me. Get out of the way. Get out of the way. That's right. Get out of the way. Get out of your way. Because remember, so many children... that was Faith. So many children have things going on with them, and we don't want them to get the help because of what others may say, what others may feel. Come on. Okay. She left. I was going to show y'all Faith, but she went away. What others may say, what others may feel, people judging us. You got to let that go. You got to let that go. Do what's best for that baby. The baby is 10. Yes, that will work. That will work for a 10-year-old. What I just said, Pamela. That will work. Yep. Get out of your child's way and get out of your own way. Sissy Keena said it best. Get out of your child's way and get out of your own way. So many of us are in our way and our child's way. Say hi, Faith. Tell him hi. Faith, tell him hi. No? Okay. All right. Okay. So no hi from Faith. That's the baby of the gang. That's the ruler of the house. She's got a lot to say. She's got don't do that. Don't do that. No. All right. Faith is hanging out with us today. Vanessa Nolan LeBlanc says she loves that pink. Let me burn it right now. Just make sure I get it off the baby before I burn it. Stacy says, hello, princess. And Vanessa says, hello, pretty girl. So cute. Hey, Faith. Faith, you're a superstar. They're all speaking to you. She's tearing up stuff. All right, guys. If there are no other questions, you want to tell everybody bye-bye? Oh, okay. There are no other questions. I'm going to get out of here. Sissy put in somebody said, Miss Frida says, Auntie Frida says, so cute. And Miss Sadie Gresham says, hi, Faith. All right. Y'all, please go over to ADHDsuccess.me. Now, let me tell you what's going to happen for the people that are already over there. There's going to be some secret stuff coming out. It's going to be top secret. But I'm going to be talking to the people who are already over there following me. All right? So, go on over there. www.adhdsuccess.me. Get that video. Tell me what you think about it. All right. I've got some big stuff coming up end of May. My book is going to be released. And what else is happening? Then we're going to, we got all kind of fun stuff. The other thing that I want you all to do is to, I'll tell you about that later. Go over to ADHDsuccess.me. Get the video. All right. I'm going to get out of here. Y'all met my little sweet things, and her brothers are probably out there having fun too. But I'm going to get out of here. I appreciate y'all for joining me. Y'all are awesome. I'm Dr. BrandiB, triple board certified child and adolescent psychiatrist. And through my Facebook live streams, my upcoming, soon-to-be-released book, as well as webinars, invitationals, speaking engagements, I help worried moms, dads, doctors, nurses, educators, whoever you are, get what you need so that you can help your children be successful in the classroom and in life. Continue to follow me right here at Dr. BrandiB. Go ahead over to ADHDsuccess.me and sign up for your free video. And I will see you all next Friday at noon. I will be talking to you all. Have a good weekend. Don't forget to stay safe. Coronavirus is still out there. And make sure you get your vaccine if it can come to you. Auntie Julia says, you're awesome also. Blessings to you and your family. Thank you so much, Auntie Julia. And the same to you. And Miss Sadie says, bye, Dr. Brandy. And I'm going to say bye. Love you all. Be safe. Bye-bye.